All right. So today with me, I have Christie Ward Coursey from Breastfeed Atlanta. She is a breastfeed specialist, like a lactation consultant. Lactation
Yeah.
consultant. And so I'll just have her introduce herself and then explain what the difference is between a breastfeeding specialist and a lactation consultant is. All right. All yours.
Okay. Hi, my name is Christy. I'm a lactation consultant. I'm an IBCLC, that means International Board Certified Lactation Consultant, and I'm the executive director of Breastfeed Atlanta. We have breastfeeding centers in Atlanta, Marietta, and Roswell, Georgia. We have a full staff of lactation consultants, and we offer a full line of services, everything from prenatal classes, home visits, office visits, group visits, and breast pump rentals, kind of anything related to breastfeeding we do. And the difference between the IBCLC and the other certifications with breastfeeding is the IBCLC is the highest level of certification that can be achieved and the only credential that is licensed in Georgia. So I'm also a licensed lactation consultant.
Awesome. Awesome. She is the real deal, and she's the person that you guys need to talk to if you're a new mom and you really want to breastfeed and you have any questions or concerns with regarding, breastfeeding your little one. So what are some things that moms need to be aware of? Most moms or a lot of moms come out of childbirth saying, I really want to try this breastfeeding thing. And for some, they're successful, and for others, they're not. Can you give us a few points on, things that you would recommend, things to look for?
Yeah, I would say just with your general approach to breastfeeding, know that although it is natural and very normal for mothers to breastfeed their babies, it can also come with some difficulty, and that is also normal. Most moms do experience some kind of difficulty with breastfeeding, and it might be like some kind of pain or some concerns about supply. Lots of things can happen, but most problems are overcomable. So if you find yourself kind of lost or, feeling frustrated in the early days, reach out and get some help, and know that whatever you're going through, we can probably help you with it.
Awesome.
And you can still be successful.
Awesome. What area do you guys cover? Are you just within Fulton County, or do you guys go outside of that?
We'll go almost anywhere within an hour of one of our clinics usually. If it's more than 15 miles from one of the breastfeeding centers, then we may charge a travel fee. But I would say we cover the entire metro Atlanta area.
Awesome. That's good to know, because I know a lot of moms, I am in Gwinnett County, and, we don't have, there's not a Breastfeed Atlanta clinic over here, but if there were moms that had questions or concerns, and they didn't want to make that trek in, maybe baby's super young, it's good to know that you guys or someone can come out to them in this area. Now, what are some things that moms could look for? I think some mom, I've talked to a few moms recently, and they talked about things like mastitis and concerns that they have, lack of supply. Can you touch on those for a second?
Yeah, so I think the most important thing overall is that when you're having a problem, the earlier you get help, the easier it's going to be resolved. Mastitis is an infection of the breast, and what that word technically means is mast is the breast and itis is inflammation. So anytime you have inflammation in the breast, that is mastitis. But what most frequently happens to people is they have like a bacterial infection of the breast, and that typically doesn't happen overnight. Usually there are several warning signs that lead to it. Frequently you have a change in your routine. So it could be that you go back to work, or that the baby starts sleeping longer. That sometimes will precede mastitis. Also, anytime you have broken skin on the breast, so if your nipples are very sore and the skin is broken, you're going to be at higher risk for mastitis. So as soon as you notice those early symptoms, like at the minute that you have pain, or if you have any kind of localized swelling in the breast, call us right away. And depending on the situation, sometimes we can ward it off altogether and keep you from getting mastitis. And then if you actually have it, then we'll talk to you and work with your physician and figure out the best course of action. It might be anything from just increasing the frequency at which you are breastfeeding or breast pumping, or you might need antibiotics or some combination of other treatments as well.
Okay. And as far as decreased milk supply, are there any recommendations? A lot of times I talk to my clients about nutrition, and how that can help a lot with their supply. Are there any recommendations from your end as a lactation specialist that you make for moms with regards to helping to boost their supply outside of just supply and demand with the infant?
So supply and demand really is probably the most important thing. So that means moving the milk and moving it often. So if you start breastfeeding as soon as your baby is born, or breast pumping if your baby's not able to breastfeed, or if you've chosen not to breastfeed directly, and do that really often, and at least 8 times around the clock. That 9 times out of 10, if you're capable of making a full milk supply, is going to lead to a full milk supply. Beyond that, if your milk isn't in by day 3 to 5, or if it's not in fully and not enough to like nourish your baby, then we need to start digging a little bit deeper and find out, do you have a thyroid problem? Do you have a retained placental fragment? Is something happening with your body that's preventing you from making a full milk supply? And get that treated right away. So I would say those are the main things, are lactation management, and then management of other medical conditions that are affecting breastfeeding.
That's awesome. That's good to know, because I think a lot of moms probably have never heard that information in their lives with regards to breastfeeding, and oftentimes they just think, oh, well, then there's just a problem with me. I can't do this. I wasn't made to do this, is what I hear a lot. And it's sad because, they have the capacity to, and I just think they don't have the education, or they don't have the support system.
The support. Yes. Yeah. So, ideally that would be wherever you're having your baby, whether it be at, a hospital, which is where most people would deliver, or the birth center, or in your home. Ideally, the people around you that are caring for you medically would be able to educate you on this and be able to tell you what to look for. However, for a variety of reasons, that doesn't happen. It could be that the provider just doesn't know, like they don't know that your history of thyroid condition is going to affect your milk supply. Or it could be that they don't have time, or that, it just doesn't come up for whatever reason. So that's why it's really good to have a relationship with a lactation consultant before your baby's born, so that we can be in communication and make sure that everything gets off to a good start.
Now, do you typically do visits prior to birth with the mom?
We like it when that happens, because we can kind of give you some basic guidelines. We can't tell you everything that you need to know about breastfeeding, just the same way we can't tell you everything you need to know about parenting or anything else in life. But we can give you some pointers and some guidelines, and we can develop a relationship so that when your baby comes, you'll have somebody that you already know that you can go to. And if you have any kind of warning signs or red flags, we can anticipate that and provide some anticipatory guidance for it.
Awesome. And what about after pregnancy? What is the typical, what are the typical visits? Like, do you guys, usually see women for several visits, one visit? How does that usually work?
That kind of varies, and we have different types of visits. So, a lot of our moms, they are doing fine with breastfeeding for the most part. Like, they're not having any true lactation issues. They've got plenty of milk, baby's feeding fine, but it can be kind of isolating. And sometimes you feel like you're the only person that has breastfed. And so we have a lot of group style visits for that, where we do education, and we kind of provide a space where moms can connect with each other. And then we also have the one-on-one visits, where we can kind of go through whatever issues you're having and address them. So, it's completely up to the patient. And, sometimes people have, like, if it's their second, third, or even fourth baby or whatever, they don't want to come to us. Sometimes they want us to come to them. So the care is really customized to the patient and the family and what they need.
Awesome. And you mentioned a little bit about like group visits. Do you guys offer breast support groups as well? Breastfeeding support groups as well for moms that they can join either locally or within Atlanta or whatnot?
Yeah, we have 8 that meet all over the city at different times throughout the day, and including 2 evening classes for people who are working, or if you just want to come in the evening. And those visits are, it's kind of, we don't necessarily call it a support group because it's a little bit more than that. Support groups are strictly peer-to-peer support, and there's definitely a space and time allowed for that during our group visits. But there's also an IBCLC there, and she's able to weigh your baby, help you with latching, address any questions or concerns that you have as well. So it's kind of a really nice hybrid between a support group and a follow-up visit.
Awesome. And what are some of the things that moms should look for with regards to, moms often wonder when they're breastfeeding, unlike the bottle where you can kind of quantify the milk, they're like, is my baby getting enough milk? So what are things that kind of cue them into the baby having adequate milk and to know that they're doing a good job?
So one thing that we really, really like about the group visits that we do is you get to weigh your baby every week, and the scale will not lie to you in this case. Now, when you're a grown-up and you're trying to lose weight, sometimes that scale will lie to you. But when you are a baby, the scale does not lie. And so it's really, really great, and I think it inspires confidence in a lot of people when you see that scale just slowly ticking upward every week. So your baby's weight is always going to tell you how much milk the baby is getting, unless your baby has a metabolic disorder, which is extremely rare. Beyond that, just like day-to-day stuff that you can look for at home, what's in your baby's diaper is going to tell you a lot about how much your baby's been eating. So breastfed babies should poop every day, and usually multiple times per day, and almost always it's nice yellow poop. So your output is a good indicator. Also, the baby's behavior in general. You should see throughout a feeding that your baby's behavior progresses from hungry and tense, and then the baby latches on and feeds well. You should hear swallowing when the baby's feeding. And then when it's over, you should have, for the most part, a happy and content baby.
Awesome. I think that's good information for a lot of moms to hear, because oftentimes they're like, well, I don't know if I'm doing this right. I don't know if they're getting enough. I don't know. Yeah. And so it's good for them to kind of have some sort of reference that they know that their babies are fine. So Miss Christy, if people want to get in touch with you, how would they do that?
Our website is the best way. You can contact us directly there, and you can also schedule appointments there. We have information about all our visits and services, or our phone number is also on the website.
Okay, and that's Breastfeed Atlanta?
Yeah, breastfeedatlantallc.com.
Awesome. So if you guys have any questions or concerns about breastfeeding, I would definitely and highly recommend you reach out to the group at Breastfeed Atlanta. They are wonderful. Christy is a wonderful resource, a wonderful clinician, and you can tell that she cares about her patients and wants the best for all the moms out there. So if you guys have any questions, concerns, need some support, definitely reach out to that group for all your lactation consultant needs. Thanks, guys.